Welcome to our new video, MCQs on bacteriology. Question number 1. Which bacterial structure plays the most essential role in the process of conjugation, the transfer of genetic material between two bacteria? Capsule, Fimbriae, pili, flagella. The right answer is option C, pili. Conjugation requires 6 pili or F pili, which forms a bridge between donor and recipient cells to transfer plasmids such as F plasmids. Question number 2. A 45-year-old man presents with chronic cough, evening rise of temperature, weight loss and night sweats. Chest X-ray shows cavitation in the upper lobe. Sputum smear is strongly positive for acid-fast bacilli. Which virulence factor of Mycobacterium tuberculosis prevents phagosome-lysosome fusion? Lipoarabinomannan, coat factor, mycolic acid, sulfatides. The right answer is option D, sulfatides. Sulfatides or sulfated glycolipids produced by Mycobacterium tuberculosis inhibits the fusion of phagosome with lysosome inside macrophages. This allows the bacteria to survive and multiply intracellularly, contributing to chronic infection and disease. Question number 3. Teichoic acids are unique structural molecules found in which type of bacterial cell walls? Gram-negative bacteria, gram-positive bacteria, acid-fast bacteria, spirochetes. The right answer is option B, gram-positive bacteria. Teichoic and lipoteichoic acids are found only in gram-positive bacteria and helps with cell wall rigidity, antigenicity and adhesion. Question number 4. The O antigen of gram-negative bacteria represents which of the following bacterial structures? Flagellar antigen, capsular antigen, somatic antigen, spore antigen. The right answer is option C, somatic antigen. Somatic antigen is the outermost part of the lipopolysaccharide layer in the outer membrane of gram-negative bacteria. Question number 5. A 2-year-old child develops severe dehydration after passing profuse watery stools described as rice water. Stool culture grows curved motile gram-negative organisms producing yellow colonies on TCBS agar. Which toxin mechanism is responsible for the symptoms? Inhibition of protein synthesis via elongation factor 2, activation of GS protein that increases cyclic AMP levels, blockage of GABA release, damage to actin cytoskeleton. The right answer is option B, activation of GS protein that increases cyclic AMP levels. Vibrio cholerae produces cholera toxin that activates GS protein, leading to persistent increase in cyclic AMP in the intestinal epithelial cells. This causes massive chloride and water secretion, resulting in rice water diarrhea and severe dehydration. Question number 6. Among the following organisms, which one is known to completely lack a cell wall and therefore show resistance to beta-lactam antibiotics? Mycoplasma, Mycobacterium, Nocardia, Corynebacterium. The right answer is option A, Mycoplasma. Mycoplasma species have no cell wall, containing only a sterol-rich cell membrane. As beta-lactam antibiotics acts on peptidoglycan, Mycoplasma is naturally resistant to penicillins and cephalosporins. Question number 7. Lipid A, responsible for producing fever and septic shock, is a structural component of which bacterial toxin? Exotoxin, enterotoxin, endotoxin, neurotoxin. The right answer is option C, endotoxin. Lipid A is the toxic component of lipopolysaccharide and it is responsible for endotoxin activity. It triggers fever, shock and cytokine release such as tumor necrosis factor alpha, interleukin 1 and other systemic effects. Question number 8. A 23-year-old medical student develops fever and painful jaw movements. A throat swab grows gram-positive rods arranged in Chinese letter pattern. Elite test is positive. What is the mechanism of the toxin produced by this organism? ADP ribosylation of elongation factor 2, inhibition of acetylcholine release, overactivation of adenylate cyclase, blocking release of inhibitory neurotransmitters. The right answer is option A, ADP ribosylation of elongation factor 2. Corynebacterium diphtheriae produces diphtheria toxin which ADP ribosylates elongation factor 2. This inhibits protein synthesis leading to cell death and formation of a pseudomembrane in the throat causing painful swallowing and jaw movements. Question number 9. A newborn develops sepsis and meningitis within 48 hours after birth. Culture from CSF shows narrow zone of beta hemolysis and CAM test is positive. What is the organism? Streptococcus pyogenes, Streptococcus agalactiae, Listeria monocytogenes, E. coli K1. The right answer is option B, Streptococcus agalactiae. Streptococcus agalactiae or group B Streptococcus is the most common cause of neonatal sepsis and meningitis, especially within the first 48 hours of life. It shows a narrow beta hemolysis and is CAM test positive, which helps to distinguish it from other streptococci. Question number 10. A farmer presents with black eschar and extensive edema on the arm after handling cattle hides. Gram-stain shows large gram-positive rods in chains. Which component of the organism's capsule is unique? Dextrin, hyaluronic acid, poly-D-glutamate, polyribitol phosphate. The right answer is option D, polyribitol phosphate. Bacillus anthracis has a unique capsule made of polyribitol phosphate. This capsule is antiphagocytic and contributes to edema and black eschar seen in cutaneous anthrax. Question number 11. Which of the following bacteria are classically known for exhibiting swarming motility on culture media like blood agar? Shigella, Klebsiella, Proteus, Neisseria. The right answer is option C, Proteus. Proteus species, especially Proteus mirabilis, shows concentric spreading swarm rings on agar due to their highly motile flagella. Question number 12. Among the following bacterial forms, which one is considered the most resistant to physical and chemical agents? Vegetative cells, spores, capsules, L forms. The right answer is option B, spores. Bacterial endospores can resist heat, UV radiation, chemicals and desiccation. The spores survive for decades due to the presence of dipicolinic acid and calcium. Question number 13. Which organism requires both X-factor hemin and V-factor NAD for growth, making it unable to grow on plain nutrient agar? Haemophilus influenzae, Streptococcus pneumoniae, Neisseria gonorrhoeae, Escherichia coli. The right answer is option A, Haemophilus influenzae. Haemophilus influenzae requires both X-factor hemin and V-factor NAD. Hence, it grows only on chocolate agar and not on plain nutrient agar. Question number 14. The McFarland standard is routinely used in microbiology laboratories to adjust which parameter during culture-based test? Culture purity, media pH, incubation time, bacterial turbidity. The right answer is option D, bacterial turbidity. The McFarland standard is used to adjust bacterial turbidity so that the number of bacteria in the inoculum is standardized before performing culture-based tests like antibiotic susceptibility testing. Question number 15. A 6-year-old boy presents with fever and a strawberry tongue. Later he develops desquamation and increased ASO titer. Which virulence factor is responsible for the initial pharyngitis? M protein, streptolysin O, erythrogenic toxin, hyaluronidase. The right answer is option A, M protein. The child has scarlet fever. That is what the strawberry tongue, desquamation and increased ASO titer indicates. The initial pharyngitis is caused by M protein, which helps Streptococcus pyogenes to adhere to the throat and resist phagocytosis. Question number 16. A sexually active woman presents with dysuria and purulent cervical discharge. Gram-stain shows intracellular gram-negative diplococci. Which media is best for isolation? Blood agar, chocolate agar with V and X factor, Thayer-Martin medium, TCBS agar. The right answer is option C, Thayer-Martin medium. Neisseria gonorrhoeae appears as intracellular gram-negative diplococci. The best medium for isolation is Thayer-Martin, which contains chocolate agar plus antibiotics. It selectively inhibits contaminating flora and allows the growth of Neisseria species. Question number 17. A food handler develops sudden onset vomiting 3 hours after eating cream pastries. What is the most likely mechanism? Heat labile enterotoxin, heat stable preformed toxin, endotoxin of gram-negative bacteria, exfoliative toxin. The right answer is option B, heat stable preformed toxin. Staphylococcus aureus causes rapid onset vomiting, that is within 1 to 6 hours. This is due to the ingestion of a heat stable preformed toxin in contaminated food like cream pastries. Because the toxin is already formed, the symptoms appear very quickly after eating. Question number 18. A child presents with whooping cough. Which virulence factor of the organism increases cyclic AMP levels by inactivating GI protein? Pertussis toxin, adenylate cyclase toxin, hemagglutinin, tracheal cytotoxin. The right answer is option A, pertussis toxin. Bordetella pertussis produces pertussis toxin that inactivates GI protein, leading to increased cyclic AMP levels. This contributes to lymphocytosis and the severe coughing spells seen in whooping cough. Question number 19. A 50-year-old diabetic patient develops a foul-smelling wound with crepitus and gas bubbles in tissue. Gram-stain shows boxcar-shaped gram-positive rods. What test confirms the diagnosis? Coagulase test, Nagler reaction, PYR test, CAMP test. The right answer is option B, Nagler reaction. Gas gangrene with foul smell, crepitus and boxcar-shaped gram-positive rods indicates Clostridium perfringens. Nagler reaction detects the organism's alpha toxin, that is lecithinase, on egg yolk agar, confirming the diagnosis. Question number 20. Which one of the following toxins is known to be heat stable and retains activity even after boiling? Botulinum toxin, cholera toxin, staphylococcal enterotoxin, diphtheria toxin. The right answer is option C, staphylococcal enterotoxin. Staphylococcal enterotoxin is heat stable. Therefore, it can survive cooking and cause food poisoning. Thank you for watching the video.